Well, pregnant women and newborn babies in every state will have access to free vaccines for the contagious respiratory virus RSV before next winter.
The federal government has announced that it will make both vaccines available nationally, one for pregnant women, the other for young babies. Well, Margie Danchin is a consultant paediatrician at the Royal Children's Hospital and a clinician scientist at the University of Melbourne, and she joins us now. Thank you very much, Margie, for taking the time to speak with us today.
Good morning.
There's been a real spike in the number of kids that have caught RSV. If you could just explain to us, how does it actually differ from other respiratory illnesses?
Yeah, I think there is a lot of misunderstanding about what RSV infection really is. And as you say, it is a virus, not a bacterial infection. So we can't use antibiotics to treat this infection. It is transmitted like other cold viruses by, coughing and sneezing. But unfortunately, young babies, especially babies under 6 months, can get very sick from RSV infection. And that really is predominantly, a lower respiratory tract infection, which can become pneumonia or something called bronchiolitis, which is like asthma in very young babies. And all we can really do is to support their breathing and their feeding. And as a paediatrician, every winter we see the wards just full of these little babies trying to breathe, not being able to breastfeed or bottle feed. And, we've never had a preventative strategy or therapeutic for these babies before.
Now, there's been a spike of 37,000 extra cases in Australia this year alone. What's behind this sudden spike?
We've actually seen this with many different types of bacterial and viral infections, and it is definitely related to the COVID pandemic and the changes in immunity, with lockdowns and all of the measures we had to control COVID. That did definitely suppress other infections as well, which meant that, adults and children weren't as exposed to these viruses as previously, particularly young children. So what we're seeing now is children, even, 3, 4, 5, experiencing really nasty viral infections for the first time because they didn't get that exposure in the first few years of life during COVID.
Yeah, I find it interesting that, some 12,000 babies have been admitted to hospital each year with RSV. But you mentioned there a lot of kids between the ages of 0 to 4 are actually affected by this. Should the vaccine only be limited to babies? Shouldn't it also extend to toddlers?
Well, as with all, vaccines and therapeutics, we really have to target it to those people who are at highest risk. And it is young babies, particularly babies under 6 months, as well as Indigenous infants, prem babies, and those with underlying medical conditions who are at highest risk of hospitalisation and going to the intensive care unit. So there are other vaccines in development, RSV vaccines for the 2 to 5 age group and then 5 to 18. So those are in the pipeline. But right now, what we are so excited about and we believe is an absolute game changer for parents is the fact that we can prevent the most vulnerable infants from being admitted to hospital.
What about pregnant women? What's the safe period for pregnant women to be vaccinated?
The program is going to be very much, as you say, oriented around safety. So it's going to be offered between 28 and 36 weeks. So pretty much that last trimester of pregnancy. And really mums need to get that vaccine 2 weeks before they deliver their baby, because we need that time for the mother to make the antibodies, the maternal antibodies, and for those protective antibodies to pass across the placenta to protect the newborn baby. So ideally 28 to 36 weeks. And the vaccine's been shown to be safe in pregnancy when it's given a little bit later.
Now, Margie, I read that the RSV vaccine is currently only available privately for women in the late stages of pregnancy. It costs up to $350. Has the cost been a barrier for mothers and their babies in getting this vaccine?
Absolutely. And that's why we are just so delighted that the Commonwealth are now going to fund the vaccine for all mothers. But as with any vaccine, it's only going to be effective if mothers accept the vaccine. So it's really up to us as paediatricians and healthcare professionals to provide the information, as hopefully I've just done, about the burden of disease, the impact on young babies, why it's important, because we need, we see like with the whooping cough vaccine, the highest uptake we get is around 80%. And as you mentioned at the start, this is going to be a hybrid program. So there is actually going to be a passive immunisation available for babies after birth that will work together with the maternal vaccine.
I wonder now, it isn't clear as to when or how long these vaccines will be provided for free for. We only know that the federal government will ensure that these vaccines are available so that there's the cases of RSV doesn't surge again in the next winter. But would you like to see the vaccine be included in the regular vaccine schedule for mums and bubs?
Absolutely. So it will be on the national immunisation program, just like the other maternal vaccines that are currently offered, which are for influenza, pertussis or whooping cough, and COVID. So this will be the 4th maternal vaccine offered. It will be recorded on the Australian Immunisation Register. And similarly with the nirsevimab, or the long-acting monoclonal antibody, which is the passive immunisation that's going to be offered to babies after delivery. We hope that those babies will get it in the first few days after delivery. That will hopefully also be recorded. It won't be recorded on the Australian Immunisation Register, but it's really important that we understand which babies are getting that and how the program's working, because the challenge here is going to be around implementation of these two therapeutics.
All right, Margie Danchin, paediatrician at the Royal Children's Hospital and clinician scientist at the University of Melbourne. Thank you for sharing your insight with us.
Thanks for having me.